Are you turning 65 soon? Then check out this quick video with step-by-step instructions on how to apply for Medicare. Before we get too far into today's topic, please make sure to subscribe to stay up to date. Believe it or not, there are yearly changes to Medicare, and there are some big changes planned for 2024 and 2025, so you want to make sure that you stay in the loop. And of course, click that like button so that we can get this information out there for others who are looking for the same type of information. Okay, so if you have any questions whatsoever about your Medicare coverage or health insurance in general, you can reach us not only in the comments below, but also at the number on the screen. As a reminder, we are licensed nationwide and there's no charge for our services, so please feel free to reach out with any and all Medicare or health insurance related questions. Let's start with Original Medicare, which is Medicare Part A and Part B. I'm going to give you a brief rundown of Original Medicare before we jump into how to enroll. So as I said, Original Medicare is Part A, which is your hospital insurance, and Part B, which is your medical insurance. Together, they're going to cover most of your medical needs. However, there are some notable exceptions that you should be aware of, especially things like dental, vision, hearing, and prescription drug. More on that later in the video. You should also know that there are premiums, deductibles, and co-pays and co-insurance. And there is no out-of-pocket maximum with Original Medicare alone. Now, because there are two parts, these costs are broken up into two parts. So let's start with Medicare Part A. Now, in all honesty, it's likely that you actually won't have to pay a premium for Medicare Part A. Most people don't. Most people qualify through theirs or their spouse's work history. So if you or your spouse have worked at least 40 quarters, which breaks down to basically 10 years, then you would qualify for premium-free or $0 Medicare Part A. If you haven't quite hit that work quota, then there is a premium that you should be aware of. So in 2023, if you or your spouse have worked anywhere from 30 to 39 quarters, then you would pay $278. If you've worked less than 30 quarters, then it would be $506 per month. However, if you keep working towards those 40 quarters, once you hit the 40 quarters, then of course you would be eligible for that premium-free Part A. And then there's Part B. Now there is always a premium for Part B, but it's actually determined by your income. This is actually Form SSA-44, which is the Medicare Income-Related Monthly Adjustment Amount. And actually, you can use this form to have your premium for Part B adjusted should you experience certain life-changing events. Very often, people find that they are paying too much for their Medicare Part B premium because Medicare is actually looking at your monthly income from 2 years prior. And if you've retired and you're therefore making less money, it's possible that you might actually qualify for a lower monthly premium. So if you scroll down here, basically this will break down what your Medicare Part B premium is based on your income. The base Part B premium is $164.90 in 2023, but it can go up from there if you have a higher income. So you see here that basically it breaks it down by brackets. So if you make between $97,001 to $123,000, then you would pay the base premium plus $65.90 and so on and so forth. So again, it's looking at your income from 2 years prior as filed in your taxes, and that's going to determine what your Part B premium is. If you are receiving Social Security or Railroad retirement benefits at least 4 months before you turn 65, then you should receive your card in the mail without having to do anything. If that's not the case, then you need to make sure that you contact Social Security via the number on the screen to enroll in Original Medicare and get your card. You can do this when you first become eligible for Original Medicare, which is the 7-month window surrounding your birthday. So the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter. You can also enroll in Original Medicare during the general enrollment, which is every year at the same time from January 1st to March 31st. This is basically for people who missed their first enrollment window. And you may also qualify for a special enrollment period. This is especially important if you're someone who's looking to defer Medicare, specifically Medicare Part B, as many people do if they continue to work past the age of 65. If this applies to you, then you want to make sure that you follow the instructions on the back of the card and send it back. Because if you keep the card, you're going to keep Medicare Part B and you will be charged for it. However, when you do retire and you lose that health insurance, at that point that would trigger a special enrollment period, so you would go ahead and contact Social Security to enroll in Original Medicare then. Now let's talk about Medigap, also known as Medicare Supplement Plans. Now, because Original Medicare has those deductibles and co-pays and co-insurance to worry about, and of course no out-of-pocket maximum, many people look towards a Medicare Supplement Plan. Because without a Medicare Supplement Plan, if you have major medical needs, you may end up with major medical bills because there is no out-of-pocket maximum. You can actually enroll in a Medicare Supplement Plan year-round at any point in the year. However, it's in your best interest to do so in the 6-month window after you turn 65 and enroll in Medicare Part B. So again, if you are going to defer Medicare Part B, then the 6-month window wouldn't begin until after you re-enroll. At this time, you will not be subject to medical underwriting, which means you can't be charged more or denied based on your medical history. Should you choose to enroll outside the 6-month window, then you may be subject to medical underwriting, which means you could be charged more or denied completely. To enroll in a Medigap plan, you first need to decide which of the 10 plans is right for you. This chart comparing the different Medigap plans is readily available on Medicare.gov, and I'll put the link to this page in the description below. So these are the plans: Plan A, Plan B, C, D, F, G, K, L, M, and N. You will see asterisks here for Plan F and Plan G. That's because they also offer high deductible versions of these plans. So, the first benefit that can be offered is your Part A coinsurance and hospital costs. This is very important. If you stay past a certain amount of time in a hospital, your Part A coinsurance can be several $100s per day. So this is a major benefit of having a Medicare supplement plan, and you will see that all of the plans do in fact cover that. Then there's the Part B coinsurance or copays. So if you do have a coinsurance payment or a copay for a Part B service or product, then it is generally speaking 20% of the Medicare approved amount. The only exception to that is the Part B excess charges, which can be up to 15% on top of that. And the only plan that's offered to new enrollees that covers that would be Plan G. We'll get back to that in just a moment. So you'll see that all of the plans will cover your Part B coinsurance. Plan K and Plan L will cover a portion of that coinsurance. In fact, they'll cover a portion of many things. That's why these plans are referred to as the cost-sharing plans. The plans will also cover the first 3 pints of blood if you need a transfusion. Again, Plan K and Plan L at a reduced rate. Part A, hospice care. All plans will cover this in some capacity. Skilled nursing facility care. Ooh, this one is very, very important. So, should you need to recover in a skilled nursing facility, again, those copays and coinsurance can be quite expensive if you stay past a certain amount of time, which is highly likely in your recovery process. So Plan A and Plan B do not cover that coinsurance. Your Part A deductible, which you may have to meet in a given year, you may not. It depends if you need to be hospitalized or not. And remember, that is applied per benefit period. So all plans, with the exception of Plan A, will cover it in some capacity. Your Part B deductible, actually no plans being offered to new enrollees will cover the Part B deductible. So ignore Plan C and Plan F because we're only looking at the plans offered to new enrollees across the board. But remember, the Part B deductible is a once annual deductible, and in 2023, it's only $226. Then there's the Part B excess charges, which I mentioned a moment ago. Plan F is no longer being offered to new enrollees, so let's just ignore this for the most part. Plan G is the only plan that does cover Part B excess charges, so if that's something that's important to you, you may want to look at Plan G. But remember, Part B excess charges are not all that common, and they are not actually allowable in all states. Then there's foreign travel exchange up to the plan limits. So some of the plans will cover this at 80%. And then there's that out-of-pocket limit, which for most of these plans is not applicable. Now, if you scroll down, you will see here that Plan N covers 100% of the Part B coinsurance, except for a copayment of up to $20 for some office visits and up to a $50 copay for emergency room visits that if you don't end up being admitted into the hospital. If you wish to enroll in a Medicare supplement plan, first you will go to Medicare.gov, at which point you'll scroll down and find health and drug plans. Over here, you would put in your zip code because pricing is determined by your geographic location. We'd click here on Medigap policy and then find plans. Scroll down again, it will ask you for your zip code again. Up here, it will ask you for some more information to give you a more accurate price. You can see if you don't put that in, then the premium ranges for specific plans is quite broad. So up here, we will put in some information just to give you a better idea. And you can see now that the range has shrunk quite a bit. Now here are all the different plans available. It says there are 12 Medigap plans because Plan G and Plan F have high deductible versions. So those are sort of the offshoots of those 10 basic Medicare supplement plans. So this will help you to determine not only which plan is suited best to your needs, but also your budget, because you will see here that the ranges differ quite a bit. Now, these variations in cost are largely due to the carrier that you choose. So regardless of which carrier you choose, for example, Plan F will offer the same benefits, but according to this, it could cost you as little as $254 per month or as much as $431 per month, depending upon your carrier. But let's say you have determined that Plan G is the right plan for you. Coincidentally, it is the most popular plan amongst our clients. What you would do is click View Policies. And then here you will see all of the 30 Medigap policies offered in your area. Now, unfortunately, at that point, basically, you have to contact the company directly because here's the monthly cost, but if you wanted to get a more accurate price, you're really going to need to contact the company. So that is one way that you can enroll in a Medicare supplement plan, is to go through Medicare.gov and then call the companies individually. Or, of course, you can work with a broker who has all of this information readily available to them and can provide you with a more accurate quote. That way you can determine what's best for your needs and not waste your time.
As I said earlier in the video, Original Medicare does not cover prescription drugs, except in some very limited instances. And this is where Part D plans come into play. These are prescription drug plans. There are actually some huge changes coming to Part D in 2024 and 2025, so make sure to check out our video that details that a little bit further. But basically, for Part D, you will pay an additional monthly premium, and that will give you access to lower cost prescription drugs. You may have a deductible to meet, but once you've met that deductible, the price of your medication will be determined by the tier of the drug. However, for lower tier medications, then those would be covered even prior to meeting the deductible. Medicare will keep track of how much you're spending as you move from the deductible into the period of initial coverage. And should you spend up to a certain amount, you may end up in the coverage gap or donut hole, where you'll notice that your prescription drug costs will increase. But if you continue to spend, you may end up in catastrophic coverage, at which point your prescription drug costs would decrease until your plan resets the following year. Medicare Part D is definitely one of the more confusing parts of Medicare, so if you have questions, please reach us in the comments below or check out one of our other videos that goes a little bit more in depth regarding Medicare Part D. You can enroll in a Part D plan when you first become eligible. That would be that 7-month window again, 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter. Or during the AEP, which is different than the original Medicare annual or general or open enrollment. The AEP, or annual enrollment period for Medicare Part D, is every year from October 15th to December 7th. So this is also a good time to review your plan on a yearly basis. Even if you already have a plan that you're satisfied with, the terms may change or a new plan may become available that's better suited to your needs. And of course, should you experience certain qualifying life events, then you may be eligible for a special enrollment period. Finally, let's talk about Medicare Advantage, also known as Medicare Part C or Managed Care Plans. these are actually a replacement for Original Medicare. So with a Medicare Supplement Plan, you have that in conjunction with Original Medicare and possibly in conjunction with a Part D plan. Medicare Advantage plans replace Original Medicare entirely, so you wouldn't have it with Original Medicare. And also, many Medicare Advantage plans actually offer prescription drug coverage, and if that's the case, you wouldn't need Part D either. These types of plans must offer at least the same benefits as Original Medicare. However, often they will offer lower copays, lower deductibles, they'll impose an out-of-pocket maximum, and they'll offer additional benefits to entice beneficiaries, things like dental, vision, hearing, and prescription drug coverage, as I just mentioned. However, these plans come with restrictive networks, and this is in stark contrast to Original Medicare, wherein you can visit almost any doctor or hospital that you so choose. With Medicare Advantage, you will need to operate within network, which can be problematic. And of course, you need to be aware of the issue of pre-authorization with Medicare Advantage plans, which again can be problematic. This is not to say that all Medicare Advantage plans are bad. Many of our clients are very satisfied with theirs, but just proceed with caution if this is the route that you're interested in. The enrollment periods for a Medicare Advantage plan are exactly the same as Medicare Part D. So it is that 7-month window when you first become eligible for Original Medicare, or the AEP, October 15th to December 7th, or a special enrollment period if you qualify. There's also something known as the Medicare Advantage open enrollment period, which is from January 1st to March 31st. So this is a time wherein if you are enrolled in a Medicare Advantage plan, you can choose to switch to a different Medicare Advantage plan, or you can drop your Medicare Advantage plan entirely and switch back to Original Medicare. You just can't sign up for Medicare Advantage if you're not already enrolled in a Medicare Advantage plan. It's basically a good time for those who may have a little bit of buyer's remorse after the AEP. Thanks for watching our short step-by-step video for Medicare enrollment. If you have any questions, you can reach us with the number on the screen or in the comments below. But before you go, please do make sure to subscribe to stay up to date, and of course, click that like button so that we can get this information out there. Thank you so much for watching and have a wonderful day. Bye-bye.